Everyone, welcome back to my pharmacology series. And today we are going to talk about really important medication, which is opioid. You need to follow a few rules to save your patient, save your license as well, because narcotic medications are very important. You need to safely access those medications from the narcotic bins. Time when you have to waste your medications. For example, you have 1 mg dose, but for your patient, you only require 0.5 mg. So you need to waste 0.5 mg. You also need someone else's signature who should be RN. It depends from agencies to agencies how they work. But wherever I did my placements, we always needed other RN's signatures to show that you wasted and they witnessed the waste. There are so many different rules that you have to follow when it comes to narcotics. If you don't follow those, you can lose your license because that can lead to medical errors. So if you go check your pharmacology lectures, those lectures will tell you to memorize the list of narcotic medication, opiate medications. You should know the formula and you should know the dosage. Let me tell you one truth that will save your sanity on exam day, that you don't need to know how to spell hydromorphone. Let's only care about if you know how to use the narcotic medication, when to use it, and what to watch for. You need to watch for your patient's heart and breathing pattern when it comes to opiate medication that can suppress the respiratory system. So NCLEX only care about that, not they don't care about if you know the formula of the medication, how to spell hydromorphone. So let's throw that textbook list out, and in this video, I'm gonna break down 3 safety rules that will help you in your next exam. So let's dive in. The very first rule for opioids, for narcotic medication, that everything goes down. So even you don't know anything about it, but if someone is on opioid medication, the whole body system goes down. So how opioid works, it blocks the mu receptor, which is the pain receptor. That's why patients are not able to feel pain when they take opioids, but body pays the price by the digestive system will go down. That's why the major side effect of sedative or narcotic medication, opioid medication, is constipation. It doesn't go away in a few days. That's why patients have to take stool softeners. The other major organ that will go down is their lungs. As I mentioned before, the narcotic medications can suppress the respiratory system. So you will see if they're having opioid medication overdose. That's why you have to be really careful when it comes to opioid medication. Always triple check your patient name, the system, the dose, the amount that you're giving to patient. Always double check everything when it comes to medication. You're not overdosing your patient. That can suppress their respiratory system. So lungs goes down, digestive system goes down, their brain, they will have brain fog because it makes them feel dizzy. So opioids are the ultimate central nervous system downers. So their CNS system will slow down when they take medications. When there's a question in exam where a patient is taking opioid medication and their respiration rate is less than 12, you